Now, for another surgery which is done for patients that are not able to hold back urine, okay, like you feeling like you want to urinate but you can confidently just hold it for like an hour, okay, if you are in something important. So some people cannot be able to do that, okay. So there's a surgery that is done which is more of like, they are trying to anchor the bladder, tie some structures, so sutures are placed on each side of the bladder, okay. Just basically, let's just discuss it. So Burch colposuspension is a surgical procedure used to treat what? Stress incontinence in women. So particularly when it is caused by what? Bladder neck hypermobility. So if the neck of the bladder is moving too much, that's why it's hypermobile. We use this Burch colposuspension for it. Alright, so an overview of this. The aim is basically to restore the support. Let the bladder neck be in one place. Let it not be moving anyhow, okay? So purpose of Burch colposuspension is what? Elevate and stabilize the bladder neck, prevent the urine leakage. So such people, they are not able to, shut down urine. So as coming is dropping little bits, So it's commonly performed in women that their pelvic floor muscles are no longer that strong, okay. So surgical technique overview is performed via open abdominal or laparoscopic approach. Sutures are placed in the paravaginal tissues adjacent to the urethra and the bladder. Okay, so these sutures are now anchored to the corpus ligament. Okay, now it creates a sling-like support that will now stabilize the neck of the bladder, or you could say the urethra. Okay, so advantages is very nice. Okay, so it's effective for a long term. Complications is, for the first times, if it is too tight, even too tight, the person wants to urinate, is difficult, okay. Pelvic pain, if they want to have sex, there's pain, and all of that, okay. So for an overview, this is what the Burch colposuspension is.